Welcome everyone, Dr. Linder here. We are going to be looking at the lower extremity. So let's take a look at this first model right here. And what you'll see is that on the anterior view, we're going to be looking at a primary hip flexor. And this primary hip flexor is called the psoas major. Psoas major. And right next to it is a muscle called iliacus. Now, sometimes together, these two muscles you may hear of being referred to as the iliopsoas, but it's really two separate muscles, a psoas major and an iliacus. But sometimes they call it the iliopsoas, where it comes together, where these two bellies blend in, they kind of converge, and right under the inguinal ligament here, both the iliacus and psoas major share a common insertion site. And that common insertion site is on an area called the lesser trochanter of the femur. But psoas major is a hip flexor, and so is the iliacus is a major hip flexor. Now here's the iliac crest, and right at the front is the anterior superior iliac spine. And again, the anterior superior iliac spine has these two muscles that look like they're originating right on the ASIS. One of them is the tensor fasciae latae, and the other is the Sartorius. So both Sartorius and the tensor fasciae latae both have a common origin, which is on the anterior superior iliac spine, ASIS. Now, on the anterior thigh, we have the quadriceps muscles. Three of them we can see somewhat superficially here. One is the vastus lateralis. The other is the vastus medialis. The most superficial is the rectus femoris. And if we were to cut this away, and I'll show you in another slice, and we were to peel this back, we'll be able to see right here the vastus intermedius. So here's the vastus lateralis. Here's the vastus medialis. Now the one that we just cut, you can see right here, the belly of the tendon is cut. We just cut the rectus femoris, so we could see the vastus intermedius. So there's a vastus lateralis, vastus medialis, and a vastus intermedius. Those are 1, 2, 3 of the quadriceps muscles. And the fourth is this one here, the rectus femoris. So vastus lateralis, vastus medialis, the rectus femoris, and then the vastus intermedius. Those are the 4 quadriceps muscles. All of them cross over the patella. You can see they all have this common insertion. They cross over the patella, and then they have their final destination or their final insertion right here on the tibial tubercle or tibial tuberosity. So when the quadricep muscles contract, it's going to pull on the lower leg, right, for leg extension. So what do the quadriceps do? They extend the leg, or leg extension, like trying to kick a soccer ball. That's leg extension. Now the rectus femoris has an origin on the, not the anterior superior iliac spine, but the rectus femoris originates on the anterior inferior iliac spine.
I'm sorry, can you say that one more time?
The rectus femoris originates on the anterior inferior iliac spine. Okay, what else do we have here on the anterior? So we've already done psoas major and iliacus. The insertion site for both of those is on the lesser trochanter of the femur. We did the TFL, the tensor fasciae latae, and here's the sartorius, which is the longest muscle in the body. Okay, it originates here on the anterior superior iliac spine. And if we follow it, it kind of runs obliquely, and then it has its final insertion site on the tibia, just medial to that tibial tubercle. Again, if you can please mute your mics, students. So the sartorius comes down and inserts just medial to the tibial tubercle, right here. It's on a region called the pes anserine, the pes anserine. Okay, now medial, right here medially is the gracilis, second longest muscle in the body. Paige, can you please mute yourself? Okay. Now, you'll see the gracilis, which is considered an adductor, as is the adductor longus and pectineus. So all of these three on the top, pectineus, adductor longus, and gracilis, all three of these have the ability of adducting the hip adduction. Okay, let's review here. Here's the anterior thigh. We got vastus lateralis, vastus intermedius, vastus lateralis. Those are three of the four quads. The fourth that's cut is the rectus femoris. The rectus femoris, you can see the tendon right here. We cut the tendon, but this is the origin, which is the anterior inferior iliac spine. Anterior inferior iliac spine. That's the origin of the rectus femoris, but all of the quads insert on the tibial tubercle. Okay, so if the quads cross the patella, they're going to do leg extension, but rectus femoris crosses the hip, so it's a hip flexor. If a muscle crosses the joint, it's got to act on the joint. Here's pectineus and adductor longus, and right here is the gracilis. Those are 1, 2, 3 adductors of the hip.